So friends, let's just get started with the part second of Pseudomonas Aeruginosa. Well, in this part we are going to concern only on the infections related to this in bacteria. So first, the infection is the pneumonia, septic shock, urinary tract infection, GIT, skin and infected tissues. So let's just begin with the pneumonia. But well, we have to concern one more thing, that this part is closely related with the infections and the patient who have high risk factor. So we'll only concentrate about the infection and the patient with the high risk groups and the common association. Like, let's just talk about pneumonia first. Pneumonia. There will be a diffuse bronchopneumonia, and the patient which will have high risk will be of cystic fibrosis patient who already had a history of cystic fibrosis or maybe occurring with cystic fibrosis. Then we will talk about septic shock. Septic shock can be through several reasons, causes. So one of the causes is Pseudomonas Aeruginosa. This is associated with purple black lesion, Stigma gangrenosum. So when the word it will be explaining the purple black lesion, then it is directly related to the Pseudomonas Aeruginosa. Then there will be neutropenic patient will be on the high risk. Okay. So next is your urinary tract infection. As I told you in part first, the catheterized patients are at high risk. Over here we can see the UTI patients with catheterized patient who have already had a history. Then let's talk about the GIT. The GIT infection will be related to necrotizing enterocolitis. Okay, so there will be some sort of infection into the colon. Then the high risk groups are premature infants and neutropenic cancer patients. Alright, so we have to think about it. If it is GIT, colitis and neutropenic patient. GIT, colitis and neutropenic patient. If it's about pneumonia, bronchopneumonia, cystic fibrosis. And the most important is septic shock, black lesion, purple black lesion, Stigma gangrenosum, and again the neutropenic patient will be at the high risk. So if you will take a wide look at the Pseudomonas Aeruginosa group, then we'll see the patient are not suffering from leukemia or something else. It is directly associated with the neutropenic patient. The patient will be having a neutrophil deficiency, not any other group. Then the last is our skin and infected tissues. Skin and infected tissue will be related with the hemorrhage, necrosis, vasculitis, dermatitis and several others like cellulitis. So the high risk group will be birth victims and patients both with one infections. Then the signs and symptoms. If we talk about the simple signs and symptoms in a pseudomonas infection, can involve different parts of the body. Basically, from the respiratory tract, as we talk about pneumonia. Then there will be related to bloodstream, that is bacteremia. Okay. Then heart, endocarditis, CNS, ear, eye, bones and joints, GIT tract infection. If there, like as we talk about colitis, then there will be some sort of diarrhea in a patient who are suffering from this. Then the skin infection, that is the Stigma gangrenosum. Okay, so let's just talk about the physical findings, like depending upon the site and nature of the infection. It will be endocarditis. I didn't mention here, but it is also important. Endocarditis, pneumonia, GIT tract infection. Then there will be skin and soft tissue infection, skeletal infection, eye infection, bacteremia, fever, tachycardia, hypertension, shock, jaundice. These are the some signs and the symptoms of the patient who are suffering from Pseudomonas aeruginosa. Then let's just talk about the diagnosis. Diagnosis can be through different ways. First, there will be CBC, that is the complete blood count, blood culture. Okay, let's just talk about diagnose in the third part. So we are over with the second part, and next part we will talk about the diagnosis, not any other infection or something. We'll directly continue with the diagnosis and preventions.